Well, with that, we are back. So we are discussing facelift surgeries, and I'm just seeing nightmares and horrors. I mean, I truly feel that, you know, age is something that just comes with time. Of course, if you feel that, you know, you have the heart and you have the bravery and the courage to go through the facelift surgery, by all means, may you have a quick recovery as well. We are in discussion with Dr. وليد. He is a plastic surgeon, of course, and he is trying to tell me that it's not as scary as it looks. But, doctor, if we can move on and talk about the disappointing result, let's say, and disappointing results, I would ask you that question because some people have extremely unrealistic opinions. If you have the face of a 55-year-old, after the facelift, you cannot suddenly start looking like a 30-year-old. That cannot happen. The doctors cannot do miracles. They can make things a bit better, let's say. Sure. So, how is it that people might sometimes feel like the result is not up to their expectation? And what could be the complications of a facelift surgery?
Before talking about complications, let us talk about the evolution of after the surgery. Yani, after an extended facelift, we have a big swelling plus bruising, and it will take time to be resolved. For that,
it's a given. It will always happen.
Yes, in extended facelift, in full facelift, 2 weeks of swelling, a buffy face. For that, the patient must to be aware about this, because they can be surprised and be depressed because they don't imagine that it will be like this. Okay, we must to tell them 2 weeks they are not presentable. They must to be
at home
without doing any stressful thing, and must to be relaxed. Stitches must to be removed between 5 and 10 days. There is a drain.
What if a stitch just like pops open?
Oops. It's easy. No, now we are using absorbable sutures, stitches. It's easy. Yani, it's not.
It's manageable.
Yes, it's manageable. The swelling will disappear progressively, not immediately. Yani, it will take time. When I said time, I said several months. For that, the definitive result cannot be seen before 3 to 4 months, even 6 to 1 year later.
Wow.
Yes, and to go a second surgery, if they need. Usually, we don't need second surgery. If they need, they will need some additional procedures like fat filling, dermal fillers, or face resurfacing by lasers or chemical peel. It can be enough to complete the result. The complications, first of all, as any other surgery, we have a risk of wound infection. For that, we give them pills, antibiotics. There is some pain and numbness. For that, we give them.
How long does the pain last?
It's a controllable pain, and within 1 week, everything will be in order. It's
and
not
of course, the patient cannot sleep on their side. Yes, they must.
In the full facelift, yes, they must to be to have to be careful about this. But in mini facelift, for younger people, mini facelift, no, it's in 5 days we remove stitches. There is a mild or minimum of swelling and bruising. After 1 week, they can go to their job, and they can have a complete social life. With ladies, they can put makeup and something like this.
Oh, see, so it's like there's
Yeah,
definitely...
always there is an alternative, but يعني the result, it's different. When you have a full face lift, you have a long-lasting result and an excellent result at all levels, يعني at the level of the muscles, skin, and fat.
I see. And Dr. وليد, I'm sure that you face many of this type of patients. They come inside to your office and they say, it's like, I want to look like this type of person, celebrity, public figure. And I'm sure that you've faced many of the people like this. But what do you tell them to go ahead and say, be you, don't be someone else?
Sure, they cannot be somebody else. يعني we have the material. Their old face is our material, okay? With this material, we can construct something, but we can, I cannot give him the face of another one or the nose of another one.
I meant it's like when they come inside, they have, like you mentioned, unrealistic expectations. They say, I want to start looking like this person.
I told them, we must stop them, and there is a simulation on our computers. There's software that we can show them how they, after the surgery, they look like what. Their new image, it's not really a new image.
It's just new but younger.
Just their old image. Their image before 10 years or 15 years. But it's not, they don't come. Other way, it will be a disfiguration.
Yeah.
If we do something, we change their look, it will be a disfiguration. And sometimes there is an extreme plastic surgeries. We must to stay in the middle, not to be extremist in our procedures.
Indeed.